Fall prevention.
So what exactly is a fall? It's a sudden unintentional change in position causing an individual to land at a lower level. Most importantly, it's not a consequence of sudden onset of paralysis, epileptic seizure, or overwhelming force.
Falls are the leading cause of injury-related visits to emergency departments in the United States and the primary cause of accidental deaths in people over 65. More than 90% of hip fractures occur as a result of falls, with most of these fractures occurring in persons over 70 years of age. 1/3 of community-dwelling elderly persons and 60% of nursing home residents will fall each year.
The elderly, who represent 12% of the population, account for 75% of deaths from falls. The number of falls increases progressively with age in both sexes, all races, and ethnic groups. The injury rate for falls is highest among people 85 years and older. For example, 171 deaths per 100,000 white men in this age group. Annually, 1,800 falls directly result in death, and approximately 9,500 deaths in older Americans are associated with falls each year.
Falls in Rhode Island. Rhode Island ranks number 7 nationwide in death rates from accidental falls in people over the age of 65. In 2005, 125 falls in Rhode Island resulted in death. This translates to about 70 people per 100,000 residents.
The scope of the problem. So if you fall, a number of injuries can occur, and that includes bone fractures and tissue injury. Most prevalent fall-related injuries are fractures, approximately 10%, and that includes the hip, spine, upper arm, forearm, and bones of the pelvis, hand, and ankle. Most serious injury is the hip injury, and it's up to 80% of admissions for hip fractures occur in women.
The cost of falls in the United States. A lot of people wonder, what is the cost associated with falls in older people? In 1991, hip fracture accounted for approximately $2.9 billion in Medicare costs. This figure could reach over $35 billion by the year 2020. The average cost of a fall in people over the age of 72 is $19,440 per person per fall.
So some of the risk factors associated with falls: poor mobility, so having balance problems or muscle weaknesses, diseases and long-term illnesses like Parkinson's, osteoporosis, high or low blood pressure, having vision problems, actually having the fear of falling, medication side effects, so some medications can actually cause falls, improper clothing and footwear may lead to falls, and environmental or situational hazards. So being in a hurry, having no handrails on stairs, in the bathroom, or on slippery surfaces, and unsecured throw rugs throughout the home.
Falls and aging. Why does your risk of falling increase as you get older? As we age, our muscle mass, vision, reaction time, and reflexes can tend to diminish. Our gait tends to slow, and our stride tends to decrease.
So some of the common diseases associated with falls include arthritis, eye diseases such as glaucoma or cataracts. There's foot problems, neuropathy, Parkinson's disease, and stroke.
So I've fallen and I can't get up.
I think we all remember this woman from the commercials. So what to do if you fall? Most important is that you don't panic. The way you react after a fall can cause more injuries than the fall itself. You want to make sure you take several deep breaths and determine whether or not you are actually hurt. If you believe you are injured, do not get up. Call 911 if you can. Use a lifeline or a call for help, or get someone in the family to help you. While you wait for help to arrive, try to cover yourself with a blanket, jacket, or maybe the throw rug that made you fall to begin with to keep you warm.
Okay, so if you are injured, it's important to follow certain steps that are provided by the American Academy of Orthopedic Surgeons to get up from a fall safely. To begin, you want to try to fall on your side or buttocks. After falling, roll over naturally, turning your head in the direction of the roll.
If you can, crawl to a strong, stable piece of furniture like a chair to pull yourself up. Approach a chair from the front and put both hands on the seat.
Slowly begin to pull yourself up. Bend whichever knee is stronger and keep your other knee on the floor.
Slowly twist around and sit on the chair.
Medications can also increase your risk of falling.
Beers criteria is a criteria used to assess the safe medication use in older adults, particularly people over the age of 65. It was first issued in 1991 by Dr. M.H. Beers, and it's something that is repeatedly revised and updated. Reasons for inclusion in the list may include the potential for a medication to cause a fall in the elderly.
So some medications that may cause falls in the elderly include those that help control our blood pressure, treat angina, Parkinson's disease, help control urine output, constipation, your heart rate and or rhythm, any allergies or cold symptoms, anxiety, depression, pain, sleep problems, ulcers, excessive stomach acid, blood sugar, blood clotting, or pain.
So the medications that are related to your heart that may cause falls are the blood pressure, the angina, Parkinson's disease, urine output, constipation, heart rate, and or rhythm. All can cause blood pressure to become too low, especially when getting up quickly from a sitting or lying position. It causes dizziness and fainting. We call it orthostatic hypotension. Mineral loss from diuretics or water pills and overuse of laxative can cause weak leg muscles, which can lead to falls. Heart rate can become too slow or regular rhythm is not maintained within the last group of medications.
So what can you do if you're on these medications? Stand up slowly after sitting or lying down. If you're lying down, sit up first, then remain seated for a few minutes, and then stand slowly. If possible, monitor your blood pressure and heart rate at home. Also, you want to ensure that you're getting regular blood work to make sure your electrolytes and minerals are in balance.
So the medications that can actually make you dizzy, these are found in products that treat allergies and cold symptoms, anxiety, depression, pain, sleep, ulcers, and excessive stomach acid. They can cause drowsiness, confusion, slowing of reactions, imbalance, and lack of coordination. This especially happens in elderly populations, and it also happens if you're taking multiple medications from within this class or groups of medication.
So what can you do? If possible, try to avoid over-the-counter or OTC antihistamines, which can also be found in some over-the-counter sleep aids, such as Tylenol PM or Unisom. Do not take more than one type of pain or anti-inflammatory medication unless specifically directed by your doctor. Also, some over-the-counter antihistamines are okay, so always ask your pharmacist before starting an over-the-counter antihistamine. For example, Claritin is non-drowsy. Also, it's important not to mix these medications with alcohol, as it may cause some excessive drowsiness or dizziness, which could lead to you falling.
So medications that can affect your blood sugar, if too much medication is taken or if you don't eat after taking certain medications, your blood sugar can become too low. This causes confusion, weakness, fainting, among all the other symptoms that you see on this slide here, like headache, shaking, sweating, feeling tired, weakness, or hunger. What you can do, you want to make sure you can monitor your blood sugar at home with home glucose monitors, replace the missing blood sugar, like through eating different sugar-filled snacks, or you can remain seated and calm till the dizziness subsides.
So some other medications that can cause falls, this being the anticoagulants, so medications like Coumadin or warfarin. These can cause an excessive decrease in your body's ability to form blood clots, which can cause excessive bleeding, which could lead to anemia, weakness, and dizziness. So what can you do? You want to report any abnormal bleeding, such as easily bruising, unusual bleeding around your gums, blood in your urine, or rectal bleeding to your doctor. Also, it's very important to get regular INR blood tests to ensure your blood isn't either too thin or too thick.